Hello, I'm Julie Miller, an Improvement Advisor with Healthcare Improvement Scotland's Focus on Dementia team, and I'm going to give you some key messages about a Scottish Government commissioned improvement project which ran from 2018 to March 21 to test connecting dementia expertise to primary care with respect to support pre and post diagnosis. Our team led in this piece of work, and an external research company, Blake Stevenson, was commissioned to independently evaluate the piece. The image on the slide is of an associated piece of work to generally make GP practices more dementia friendly, which you'll find on our web pages. The following three GP cluster sites were selected to be part of the programme: East Edinburgh, an inner city cluster; Nithsdale and Dumfries and Galloway. This cluster covers a mix of town, village and rural settings; and Shetland. This cluster covers the whole island group away up there in the Northern Isles. Each site was given $50,000 per year, and the brief was to deliver post-diagnostic support from primary care. But we allowed the sites to innovate, and as a result, we also had a focus on supporting people before diagnosis and receiving a diagnosis in primary care. My team provided support to apply quality improvement methodology and to access peer support, and we generally monitored and reported on progress. The ensuing pandemic obviously had a significant impact in the final year of the programme, but the evaluation focuses on activity pre-pandemic where necessary. This is what each site did. East Edinburgh cluster directly employed a worker to provide dementia support pre and post diagnosis. This worker moves around the 8 practices in the cluster and crucially can access the patient records on the GP systems at all practices and can do this remotely. This means she can update the key information summary, making sure that dementia and anticipated care planning information is recorded. She can also check the GP lists to see that no one has been missed for post-diagnostic support, and people are still diagnosed in secondary care with this model, but if the worker has supported them pre-diagnosis, they will come back to her for support following that diagnosis. Shetland focused on completing their pathway from assessment to diagnosis to receiving post-diagnostic support. They have had an interesting model of mental health nurse-led diagnosis for several years. GPs refer to the nurses who assess and diagnose, and their findings are corroborated by a mainland psychiatrist via video call. Through this initiative, a discrete post-diagnostic support role was created and is now attached to the assessment service. Once the person is diagnosed, an automatic referral is made for post-diagnostic support. Nithsdale focused on people being assessed and receiving their diagnosis in clinics in the GP surgeries. Waiting lists were an issue in Dumfries and Galloway beforehand, and people were waiting a long time to be diagnosed, waiting for 9 months to be assessed. So a feature of this work was, like Shetland, to equip others to undertake the assessment and diagnosis. Sadly, COVID-19 put a stop to the GP clinic model, but Nithsdale are continuing to build in the nurse-led diagnosis model and are dedicated to maintaining and building connections with primary care and improving care coordination. I'll now show a few findings from the models on the next slide. East Edinburgh. So 100% of people who are newly diagnosed in this cluster patch were referred for post-diagnostic support, whereas the published data shows that only 43% of people newly diagnosed are referred nationally. The completion of the full year of support was 84%, which again is higher than the overall Lothian and national averages. Nithsdale, focusing on the GP diagnosis clinic model, where OTs and nurses carried out the assessing and diagnosing with reduced input from psychiatrists, their wait time from referral to diagnosis reduced from 9 months to 53 days. And you'll see on the slide there's a range of savings that can be made with this model. In Shetland, as with East Edinburgh, no one gets missed for post-diagnostic support. Everyone is referred, and the take-up of the support has gone from 40% to 84% now that there is a PDS worker attached to the assessment service. Some assumptions have been made around cost savings, particularly around GP time to diagnose if the nurse-led service didn't exist, but there's an estimated saving of about $37,000 per year with this model. The evaluation report concludes by saying that lessons from the 3 sites reflect key elements of the dementia journey and should be considered by those looking to improve the quality and experience of dementia care and support. Each site's work has elements that, if combined, might make a much better pathway for people. Support before diagnosis, having nurse or dementia practitioner-led diagnosis to help with timely assessments, and support delivered from the GP practice where key information is recorded in the patient record and care can be coordinated from this central point that is familiar to the person and where people are likely to know you and your family. Focus on Dementia are obviously now sharing the learning from this programme. See the links to our website for the full report and our email address if you want to get in touch. And of course, I'm happy to answer any questions posed throughout the day. Thank you.